Did you know that one of the key efficiencies of humans is the ability to create habits? The brain's pretty clever. We're able to do something without even thinking about it. That's great. And there's kind of two types of ways that the brain creates habits. One is impulsiveness, so it's the reward centers of the brain. So if we do something and it's rewarding, we'll release dopamine and we're more likely to do it again. And in fact, we'll start to release dopamine in anticipation of doing that thing. So that's one way. And the other way is through repetition. So we've got a part of the brain that the more times we do something or more often we do something, the more likely we are able to do it without thinking about it. So there's like a stored memory of how to do it, and so we're able to do it without even thinking about it. So that's great, right? But did you know that the parts of the brain that are involved in creating habits are not the parts of the brain that are concerned with our long-term well-being? So this is interesting and relevant because imagine, so most people don't even know what their habits are, and they certainly don't really know what their bad habits are. But what happens if you decide you have a bad habit? So let's say you become aware of a bad habit that you have, that every time it's 3 p.m. you reach for a chocolate or a latte or some sort of coffee to perk you up because you've got 3:30itis and you start to feel tired. Let's say at that point you decide, you know what, I'm going to change this habit. And you decide you're going to use willpower, good old-fashioned willpower, to change this habit. So you're going along in your day. Your day starts like this. You wake up, you decide what you're going to wear, you decide what you're going to have for breakfast, you manage your kids, you decide which route you're going to take to work, you get to work, you check your emails, you do a few things on autopilot, you make a few decisions, there's a few distractions that come up, a few things that demand your attention, you then take a break for lunch, you think about what you're going to have for lunch, you make other decisions during the day, and 3:30 comes along and one of two things happens. Number one, you just automatically go find yourself at the vending machine and you've bought that chocolate bar, and then you realize, oh, that's right, I wasn't going to have this today. Or you start to think about, oh, I could really use that chocolate bar right now, and you start to think, or you start to make a decision about whether you should or shouldn't have the chocolate bar, right? Because the reward center of your brain saying, yeah, let's have that chocolate bar, I really need that chocolate bar. However, your prefrontal cortex, the part that makes the decisions, is tired. You've got decision fatigue. You've had a long day, you've made lots of decisions through the day, and you're tired of making decisions. So you outsource that to another part of your brain, and you give in to the impulse. So the part of your brain that is making decisions or involved in willpower will be overridden in times of stress or when it's tired. So it's not the most reliable thing to rely on when you're wanting to change behavior. So bearing all that in mind, which a lot of people don't know, is then come along and you decide that you need to lose weight or shift some extra kilos. So you go and see your personal trainer who gives you an exercise program, or you see that there's a 12-week challenge and you decide you're going to hop on that 12-week challenge, or you go and see a nutritionist or a dietitian and you get a meal plan, or perhaps you pop in and you get the latest fad or whatever the diet is that says, and you follow this basic principle that says, right, all you need to do now is eat less and move more and problem solved. In context of what you've now learned about your brain and habits and behavior and influencing them, how effective do you think an approach of just being handed information about what to eat and how to move, or information that you need to eat less and move more, is going to be? On a scale of 1 to 10, you're going to, hopefully in light of this information, know that the chances of success are going to be really low without the benefit of extra information and without the benefit of support. But time and time again, people jump on this bandwagon of let's eat less and move more in order to lose weight. And time again, they fail to obviously do those things, and they don't get the results that they want. So the question that I'm compelled to ask is, what is driving behavior, And that's the question that I'm asking all of my clients. I'm getting really curious with my clients when I'm working with them. What makes you do what you do? Why are you doing it? How are you doing it? Do you understand all of those things? Because that's the thing that makes a difference. So I believe that we cannot change behavior unless we're understanding what is driving behavior. And unfortunately, most programs aren't structured that way. So in these 2 days, I'm going to unpack for you why you do what you do, how you do what you do, how to change what you do if you need to change it, and understanding what your body needs in terms of its physiology, its biology, its psychology, and what your brain needs and how your brain works, and all that really important information that you need if you want to change behavior, because that's really what we need to change. It's your behavior around your eating or behavior around your moving, the behavior that is in the context of your life, and we need to understand that context better. And so that's what this 2-day workshop is about. It's all about the context of your life and helping you understand yourself better, your brain, your psychology, your relationship with food, your nutrition status, what you really need, rather than you need to quit this macronutrient in order to lose weight. And really importantly, why dieting isn't the answer, and actually how dieting can actually cause more problems down the track. So who's this for? I can't think of anyone that this isn't relevant for. Who doesn't need to know about the way that their bodies work and their minds work, and who couldn't benefit from understanding how to change some habits? But specifically, people that will benefit from this 2-day workshops are people that are struggling with their weight, or have been on yo-yo diets, or people that are struggling with their relationship with food and would like to be able to better manage that. And mums, definitely mums, because a lot of mums don't realize just how much they influence their children's eating habits. And it's also relevant for health professionals or personal trainers, because it will enable you to be more supportive to your clients and help them on their journey, because you'll be able to understand why they behave in certain ways and also how to help them influence that behavior. So it's really important 2 days. It's really content rich and very, very strategic, and lots of opportunity to work on yourself and to get great insights. So very practical. I look forward to seeing you there. Join me and register below. See you then.